Hey everyone, it's Biggie, and welcome back to my channel. Today, we're going deep into a topic that's close to my heart: breast cancer. You know me, I'm all about keeping things real and informative. We're going to break down the walls and get right into the nitty-gritty of breast cancer. We'll cover everything from what causes it, how to detect it early, and the different ways we can treat it. Now, I know this topic can be a little scary. Believe me, I've seen my fair share of lumps and bumps over the years, and I understand the anxiety that comes with them. But knowledge is power, right? The more we understand about breast cancer, the better equipped we are to fight it. So, whether you're just curious about breast health or you've been personally affected by breast cancer, this video is for you. Let's get started. So, what exactly causes breast cancer? Well, it's a bit of a complex story. You see, our bodies are constantly creating new cells, and sometimes those cells in our breasts decide to go rogue. They start multiplying out of control, forming a tumor. Now, there are a few things that can increase your risk of these rebellious cells. First up, we have genetics. Yep, just like you might inherit your mom's curly hair or your dad's sense of humor, you can also inherit a higher risk of breast cancer. This means if you have a close family member who's had it, your chances of developing it might be slightly higher. But don't freak out just yet. It's important to remember that most breast cancers aren't hereditary. Then we have environmental factors like exposure to radiation or certain chemicals. These sneaky culprits can damage our DNA, potentially leading to those pesky cell mutations. And of course, we can't forget about lifestyle choices. Smoking, excessive alcohol consumption, and being overweight can also up your risk. But hey, we're all about taking control of our health, right? Let's talk about early detection, people. This is where we become our own health advocates. The earlier we catch breast cancer, the better the chances of kicking its butt. So how do we become breast detectives? First off, get to know your girls. Yes, I'm talking about your breasts. Regular self-exams are crucial. Once a month, take a few minutes to feel around your breasts for anything unusual like lumps, thickening, or nipple discharge. Don't be shy. Get familiar with your body. Next up, mammograms. These are basically like X-rays for your breasts. They can detect lumps that are too small to feel. Ladies, once you hit a certain age, make those mammogram appointments a non-negotiable. And hey, if you notice anything unusual between mammograms, don't wait. Go see your doctor right away. Remember, early detection saves lives. Okay, so you felt a lump, or maybe your mammogram showed something suspicious. Now what? Well, it's time to get a diagnosis. The first step is usually a biopsy, which sounds scarier than it is. It's basically just taking a small sample of the suspicious tissue and examining it under a microscope. Think of it like this. We're sending that tissue sample to the lab for some serious interrogation. We need to know exactly what we're dealing with. Along with the biopsy, your doctor might order some imaging tests like ultrasounds or MRIs. These tests give us a clearer picture of what's going on inside the breast. And finally, we might do some lab tests to check for certain markers in your blood. All of this information helps us determine if it's cancer, what type of cancer it is, and how far it's spread. All right, let's talk about prevention. While we can't always control everything that happens to our bodies, there are definitely some things we can do to lower our risk of breast cancer. First and foremost, a healthy lifestyle goes a long way. Eat your fruits and veggies, exercise regularly, and ditch those cigarettes. And hey, if you enjoy a glass of wine now and then, that's totally fine. But moderation is key. Now, for some people who are at higher risk of breast cancer, there are medications that can help reduce their chances of developing the disease. These medications work by blocking the effects of hormones that can fuel breast cancer growth. And remember, knowledge is power. Talk to your doctor about your individual risk factors and what preventive measures are right for you. Okay, so we've talked about causes, detection, and prevention, but what happens if you are diagnosed with breast cancer? Well, the good news is that we have a whole arsenal of treatment options available, and the best approach depends on a few factors, like the stage of the cancer, your overall health, and your personal preferences. One common treatment is surgery, which involves removing the tumor and sometimes surrounding breast tissue. Then there's chemotherapy, which uses powerful drugs to kill cancer cells throughout the body. And of course, we have radiation therapy, which uses high-energy rays to target and destroy cancer cells. In recent years, we've also seen incredible advancements in targeted therapies, which are designed to specifically target cancer cells while leaving healthy cells unharmed. It's like having a team of microscopic ninjas going in and taking out the bad guys. Now, before we wrap up, I want to address something that many people don't realize. Men can get breast cancer too. While it's much less common in men than women, it's still important for everyone to be aware of the signs and symptoms. Just like in women, men can develop lumps in their breast tissue, experience nipple discharge, or notice changes in the skin around their nipples. If you're a guy and you notice any of these symptoms, don't ignore them. Go see your doctor and get checked out. The good news is that the same treatments that work for women with breast cancer are also effective in men, so early detection and treatment are crucial for everyone, regardless of gender. That's it for today's deep dive into breast cancer. I know it was a lot of information, but I hope you found it helpful and empowering. Remember, knowledge is power when it comes to our health. By staying informed about breast cancer, we can take charge of our breast health and make the best decisions for ourselves and our loved ones. If you found this video helpful, please give it a big thumbs up and share it with your friends and family. Let's spread awareness and support one another, and don't forget to subscribe to my channel for more informative and entertaining videos on all things health and wellness. Until next time, stay healthy, stay curious, and take good care of those amazing bodies of yours.